For the record, I haven't been to the gynecologist, but Representative O'Day may have.
Always picking on him. You're always picking on him.
Mr. Massie.
You know, the thing that I find really incredible about this whole discussion is that we act as though this problem can't be solved by anyone anywhere in the world. And yet, if you look around the world, most countries have managed to provide health care for all of their citizens as a right at a very high quality level. Now, I can speak as someone who has benefited from the best quality health care one could possibly have in the United States, but I know that it was not always easy for me to get it. My own medications, before I had my transplant, were very expensive, and it was sometimes a real problem. My parents wondered if they would go bankrupt, and we had some real difficulties with this. I lived in Europe for a number of years, and the amazing thing was that I was covered under the European health insurance system, even though I wasn't a citizen. I was simply a resident. But they decided that because I was a long-term resident in the country, this was actually in France, that I would be covered for these expensive medications. I, in fact, owe my ability to walk because I had these medications on a continuous basis, which probably would not have been available to me in the United States under our private health insurance system. So this is a problem that has been solved and can be solved. I was in favor of single payer. When that was pushed off the table, I was in favor of public option, and I'm still in favor of public option, which offers people the opportunity to buy into a government program. I think it is incredible already that there are 70 or 80 million people who have essentially government health care, people in the military, people, federal employees, veterans have federal health care already. And frankly, I think it's absolutely unbelievable that the Republican members of Congress, including Scott Brown, take federal health care, in essence, for themselves, while saying that 50 million people in the United States, that's 1.5 times the population of Canada, should not have access to health care. I think it's incredible, it's immoral, it's un-American in a fundamental way, and that's why I think it absolutely has to stop. In terms of the President's Act, if the President can succeed in this bill in approaching the objectives that we had in public option, if that works, so be it. If we find that we are not achieving those goals, we need to put that public option back on the table.
Thank you, Bob. Representative Conroy.
I also supported the public option. Unfortunately, it didn't get included in the President's bill and now law. I do think we need to defend it, however, from the Republican right, who just wants to completely unwind it and defeat it through the court process or perhaps even the legislative process. It is a step in the right direction. It's a flawed law. I'm not going to sit here and defend it. But it's moving us in the right direction. I think the right direction is something more towards where everybody has access to health care. It's all affordable, it's all of high quality, and it's guaranteed for everyone who's a resident of the United States. That is the direction and the path that I want to push us towards, and I'm actively doing that at the State House as the Vice Chairman of the Healthcare Finance Committee. We are trying to address the cost issue here in Massachusetts, while the rest of the country is just trying to get access. As my colleagues have said, 47 million Americans don't have access to health insurance. They are facing a catastrophic loss of income and money and livelihood if there's a serious illness in their family. And that's not right. And so the law that got passed last year would put an end to those kind of catastrophic consequences, which is a good thing. But it doesn't go far enough, and it doesn't push us far enough. And so here in Massachusetts, we're trying to take that next step in terms of controlling costs. And that includes issues and paths and models that have been worked out in other parts of the country that are quite successful, that are lower cost, higher quality treatment methodologies for people with chronic conditions, diabetes, and the rest. I also want to say that I'm a big believer in the life sciences and biotech industry, and I'm a champion of those industries here in Massachusetts as a way towards lowering costs and getting rid of some of these diseases like cancer and like diabetes and multiple sclerosis and all these other chronic conditions that are costing a lot of money. So we're on the right path. We do have to tackle these complicated issues. There is a lot of waste out in the, and inefficiency in the system. We've got to root that out of the process. We've got to make it easier for patients to obtain preventative care. We've got to focus on wellness and nutrition and preventing people from getting sick in the first place so that they don't get into those catastrophic illnesses. And these are all the different, we've got to tackle medical malpractice. We've got to tackle the end of life where a huge portion of spending goes on in either the last 6 days or the last 6 months of life, trying to preserve people when perhaps hospice and palliative care might be a better path for folks, and certainly of higher quality. That's been proven. So lots of different issues that we're all trying to tackle here at the state level. I'd like to see those replicated once we finish that bill in the next year at the federal level as the next step on top of that federal law. But let's use it as a platform to move down a road where everybody is guaranteed health care that's affordable and high access and high quality in this country. Thanks.
Thank you.